of people this time. So, you know what, I wanted to talk about, I had seen, you know, how many of you are on our Facebook, the private Facebook? You know, someone had posted on there, and it made me start thinking. She had posted about problems with regaining weight after surgery, which, I mean, there's a lot of people who are, you know, you're still pretty new out, but it's a problem. It exists, and I'm not sure how many people really kind of buy into the fact that regain does exist. So I just kind of wanted to talk about it, and Dr. Gatt's here, and I'm sure she'll have some input on it also, but it seems to be that after a couple years, you know, you start getting kind of comfortable and kind of real relaxed with what you've been doing because you know it now. You completely know it all now. But you become complacent. And as soon as you start becoming complacent, that's when you get in trouble. You know, I mean, just if you can give me a show of hands, because I can't remember. 6 months out? Anybody 6 months out? Under a year? Okay. How many people over a year? 2 years out? 3? 4? 5? Okay. So I'm just gonna, if you guys don't mind, I'll ask you some questions. Have you struggled with any of that? You guys just bouncing up? I'm not sure if you guys came to the support group when Dr. Tussaud and Dr. Yadegar were here. And Dr. Tussaud is a doctor with Kaiser, and they were talking about the weight of the nation. Were you guys here for that? It was actually a very interesting support group, because Dr. Tussaud talked about when you lose a bunch of weight and you get at a weight that, you know, you've gone beyond what would be, I guess, lack of a better term to call it, your set point. You know, I believe that your body has a set point, and that but what he and Dr. Yadegar went further to say is that you get to that set point, but beyond that set point, but you have to be able to maintain that weight. Wasn't it for about a year? And you have to try to push yourself beyond that, you know, thing. What about you? Have you had any, because you're further out, have you had any bounce issues that you've tried to get rid of?
About that, I love that you said that. It's definitely a lot of it's psychological hunger. And I always tell patients, and you guys have heard this a million times, the surgery fixes this, it doesn't fix this. And so the emotional eating you were doing before, you know, there's that honeymoon period a year or two out, right? And then everybody's back here struggling with the same issues, and that's boredom eating, it's eating emotionally, it tastes good. So at first you're jazzed and you're motivated, the weight's coming off, you have no problem, you don't even think about food hardly. And then life happens again, and there are your issues again. So those are the important things to recognize. Why are you eating psychologically? It's not just about food, it's about something deeper that's going on. And it may not be something traumatic or deep-seated, but there's something there that led you probably to the weight gain in the first place that you still haven't addressed, that's now coming back into your life.
67% of this whole process is you. The other 33% is the surgery. So the surgery only works about 33% for you, but the other 67% has to come from you. So it has to really boil down to the discipline that you put in it. You know, and there's more to than just the eating. There more than getting our water in. It's what else are you doing? Are you getting out and moving? Are you getting the exercise in? Were you doing the exercise before? Has the exercise gone away for you? Has that left you? You know, and sometimes you got to find whatever it is that's going to spark you to get and move forward. You know what I'm saying? And I don't know about you guys that are fairly new after having the surgery, but I know for myself, I was absolutely petrified when I noticed, I think it was about a year, almost a year and a half, that, oh my gosh, I can eat more than I used to, you know? And I was absolutely like, oh my gosh. I was petrified that I was going to gain my weight back, because it's like, well, no one told me, truly no one told me that I would be able to eat more down the road. I think, you know what, I think a lot of it is that we become complacent. We think we know what we need to do, and you guys are 4 and 5 years out.
Yeah.
So if you think about it, and I saw a video, I can't remember who the video was on, but when you get to a place when you further out, like you guys, like you, like myself, you know what, you're pretty much normal again. You know, you've got this tool, but there's more normalcy now. You don't have that honeymoon that you had in the beginning, you know. And so now that we all are more normal than, as I call it, altered, you know, how do we deal with that? How do we deal with it? You know, how do you deal with it?
That maybe you can sort of connect with. So we're driving in America, we drive on which side of the road? The right side, right? And that's normal to us. We do it unconsciously. It feels right. If you move to England, you drive on the right side of the road, what's going to happen to you? You're going to die, crash, right? So for many of you, your old eating habits, had you continued, that was going to put you at a serious health risk, right? It didn't feel good. Something was not right there. So, but now you've moved, so with the surgery, it's kind of like you've moved to England. And now you know, it was strange, it was new, it's a little bit easier because your body was forcing you into that left-hand lane. But now your body's starting to veer back into that right-hand lane, right? And you're starting to go there because that's old habit. That's what you've done for years and years and years. You have to start going back into the left-hand lane where it doesn't feel good, it feels awkward. So you're cutting out things that are habit, right, that you've reintroduced that perhaps you probably shouldn't have, that are adding to your weight gain. So this is not, sometimes I think we're looking for some easy road. If we come to support group enough and talk about it, maybe it'll just happen. We're talking action here. So it has to be the behavioral as well. So, and then again, if there are psychological problems down below, seeking some help, you know, going and getting a therapy session or two and discussing that. And I think I know, Liz, you write down everything you eat. I mean, being accountable.
I journal everything.
Mm-hmm.
I journal what I eat for every meal. I know Dr. Yadegar likes when people are journaling. He likes you to write down how many calories it is, how much protein it is. But you know what? I journal what I don't put that in. I know pretty much my protein and everything. But I journal breakfast, I journal lunch, I journal dinner, I journal snacks, I journal how much water I get in for the day, plus I journal my exercise. It sounds absolutely obsessive, but I can look back and say if I'm having, like, wow, where did that weight gain come from? First of all, I know if I didn't journal it and all of a sudden I've gone up 5 pounds, oh, I know where that came from. It's what I didn't put in my journal.
Right.
Because you know what? It can only be as honest as you put down. But you know what? You know when you're having something that isn't right. One of the things I used to be, in the beginning, I used to be real just obsessive about getting on the scale and weighing myself. But I have come to the conclusion after all these years, you know, it's been 9.5 years, that I don't need the scale to define what my numbers are and my health. Because you know what, I work out every day, I eat pretty clean, I get my protein in, I get my water in, so I know what I'm doing. And you know what, and I'm human. I slip, I fall. But, and this is something that's really funny, is that, and I was talking to someone else who hasn't had weight loss surgery, and she's been doing a program. She said she does better when she's at work versus when she's at home. She says on the weekends or whatever her day off, that's where she struggles, is on her time off from work.
And sometimes, again, ask yourself, and sometimes when you're eating and you know you're not hungry, what am I feeling that I'm trying to medicate? And sometimes it is boredom.
Usually
right?
it's boredom.
Yeah.
One of the things I'll find at work is that if I'm really busy and I've been like sitting in front of the computer and I get up and I go down to the kitchen to get some ice, they have this stupid drawer there that has these horrible, horrible unsalted crackers. I don't know why, but I like them. And I will pick up, they're about that big, the crackers, and there's 2 to a package. I'll usually get 2 of them. They're horrible things. They taste horrid. I could get the graham crackers that are behind there, but I get these stupid little gummy crackers. And let me tell you, it's an effort for me to make sure I don't get in the drawer. I'm glad sometimes when I open the drawer, I'm like, oh, they haven't been here yet to refill, But I mean, there's habits that, even at work, that you develop, I make a point to stay away from, because, as we talked in the support group a couple months ago, and Dr. Yadegar said, maybe you could have a little bit of that at Christmas or at Easter, and then you're not going to have it again until Christmas. You're okay with that. That doesn't work for me. I stay away from the people's offices that have chocolate sitting out on their desks, or any kind of sweets, because I truly have no control over it. I really have no control, so I have to really do, a stiff strong arm against that stuff, because those are the things that I know that got me in trouble, 10 years ago, before I had surgery. So for me, I really work on keeping myself in check, because otherwise it's just too easy. It's a control thing. It really is, and I don't know if anybody else has that issue with things feeling like they just get too out of control for you, in terms of, I tell this story a lot. It was way before I had my surgery. I would drive down below to go work at the emergency room. I used to work in the emergency room at Olive, and so I would go to the gas station and I'd get gas. And in my mind, the way you justify things in your mind, I would get a 44-ounce diet soda. I put it in my car, but I also got 4 big giant candy bars. And I would eat 4 candy bars on my way down below and wash it down with my diet Pepsi. But those were my rationalizations, because, I was out of control with 4 big old giant pieces candy bars. And they were really bad, like Snickers and Butterfingers. And I rationalized it because I had a Diet Coke. Really? So, as I know, for me, I have to stay away from that stuff, because it's just totally dangerous for me.
And of course, if you eat off somebody else's plate, it doesn't count. Or if you go to Costco and have a sample, that doesn't count. There's all those rationalizations that we use, right? And sometimes it's amazing now that they post, calories everywhere. A muffin that's that big has like 200 calories in it. And it's like you could chow that down in one bite.
Now that you said that, does anybody, when they go, because it's usually, large chains and stuff.
Yeah.
So whenever you go to a restaurant like that, does what they have on the menu, does that make a difference if you pick it?
The calories?
Yeah. It absolutely, I'll look at stuff, I'm thinking, oh, I'll get that. And I look at it and go, oh, no, I can't have that. And then I know I bring home at least half, I bring home half of it and half that and have, 2 more meals out of it. But it's really, so I eat a third of the whole meal. But it's still, I'm sitting there going, okay, and the thing is, when you go out to eat, one of the things you have to be careful is when you go out to eat, how the food is prepared. Usually it's very salty. It's very, very salty, because that's what tastes good. And it's usually very fatty. So, it's all these things that you have to look at to kind of help keep yourself in track. And the calorie thing really will make me definitely think twice when I look at the calories, the fat, everything in something at a restaurant. I guess my question is for those who've experienced regain, how do you keep forward motion now?
I think it's more just like maybe the coffee bean drinks, and I've noticed lately, like you don't get the whipped cream on it, things like that. And making small changes sometimes instead of going all whole hog, we can just start small. But I know sometimes you beat yourself up when you go, you say, I don't know if you tell yourself you're a failure, but it's like being down on yourself for gaining that 25 pounds. But it hasn't come up, it's been 25 and it's plateaued there. I mean, I'm not making excuses either, but sometimes too, if it's a few pounds or 10 pounds, maybe it's okay to say, well, you know what, maybe this is where my body needs to be as well.
I believe that your body, I completely agree with that whole, your body has a set point.
Yeah.
I believe you can force your body beyond it to another set point.
Yeah.
With one of the things with me, with as much as I work out and stuff, it's not about, when people ask me, you're still trying to lose weight? No, not really. What I'm doing is I'm trying to just become more lean, not necessarily lose weight. It's about really being more lean and more fit. I started eating very emotionally and very, very much stress eating. And I popped up probably about 38 pounds. I put on about 38 pounds. I was like, ah! And so I thought, okay, I have to do something, otherwise I will be over 300 pounds again. So I basically put my nose to the grindstone, and that was the question that was asked on the Facebook post. Can you lose weight after you've had a regain? I actually talked to Dr. Yadegar about that. He said yes. He says, but it's just like before. That's exactly it. It's just like before you had surgery, is basically what he told me. So basically, once you have that regain, the further out you get, it's just like before surgery, except you now have a tool to help you with it. Just like the statistics Adrian dug up, that it's 67% what you do and 33% the surgery. I know for me, for a fact, being 9.5 years out, I know the surgery still works for me. I can feel when I eat, I feel full. I know that I have to maintain portion for two reasons. First of all, because even if it's good food, too much of good food can be bad for you. And the other thing is just that I feel horrible when I overeat, So, but I mean, and it was that the weight gain was very, very difficult for me. Not necessarily that I felt like a failure. I was just frustrated. I was really frustrated that I allowed myself to get out of control. And that's what I think my big fear is that, and it was all, and I know why the weight came on. It was because I was eating out of stress, and I was sad.
That's why, listen, this is only a tool, and I tell I do the psyche eval prior to surgery.
Like you said, your body adapts too.
Yeah.
Your body adapts.
It's homeostasis, it adapts.
Yeah.
And you can go back, that's why we see people regain. I tell every
it's
client,
comfort.
I have a crystal ball. Your first year or two will be a honeymoon. It just happens. People are going to compliment you. It's lovely. Not everyone. Some people go through some different, the weight loss brings emotional jealousy and all kinds of other issues. But for the most part, it's a lovely time. And then you hit that 1 to 2 years, and I'm telling you, you're going to be struggling again. I tell people that your relationship with food will have to change for the rest of your life. Are you understanding that? And you have to mourn that. Some people have to actually go through a little bit of a mourning process. This will not be part of your life anymore. But you will find things to replace that, like instead of enjoying the food, you're enjoying the friendship more. You're being more in the moment. and try, and that eventually will fill you emotionally, maybe as much as the food. But you know what? You may miss the food for the rest of your life. But if you want to keep that weight off, that's an emotion you're just going to have to sit with. You know? So life is about pain, and I think life, you know, life happens. And I think there's this false expectation, oh, once I get to a certain weight, everything will be fine. You know, that magical thinking. You know, my life will be great.
Or a certain size.
Or what?
A
Or
certain size, weight, yeah.
No one will be mean to me again. No one will cut me off on the 405 ever again. Because I'll be just, you know, doesn't happen.
And I think with a lot of people, that's the big thing, is that if they say something to someone, they feel that they're going to be judged.
Yeah.
You know what? I think as just human beings in general, we're just fearful of
Absolutely.
being judged. I was there. Irit happened to be there, so she sat down with us. And I mean, my friend was there, and she's dealing with some very serious health problems with her husband as well as herself. And it turned into this huge session.
Yeah.
And I mean, I was able to talk about what was going on. And I truly believe after I'd had the phone call and I called her and I told her what was going on, it was like, we have this thing, like you guys, we meet for tea. She goes, we need tea. So we met and we had tea and we talked about it. And we were probably there a good couple hours that we talked about it. But it was, again, had I not talked about it, I think it would have been just shoved down. And then eventually I probably would have popped and probably did something destructive and eaten something. And it really boils down to, as you said, what do? We use a lot of times food to medicate our feelings, you know. And then it's like, because there's a pleasure center in our brain, and I cannot remember for the life of me right now, but basically it secretes a hormone that dopamine. And when you have that dopamine response by whether it be cocaine or chocolate or whatever, it's the same addiction, but it's that thing that calms you.
Yeah. Just to let you all know that I'm part of, you know, the team, Dr. Yadegar's office, and if you can't get in to see your psychologist at your HMO or PPO, or you need someone, or it's a 3-month wait list or whatever, I work on a sliding scale. I work out of Dr. Yadegar's office. I mean, it's a place that you know, so feel free. I mean, I have cards today where they have my number at the office. You're always more than welcome. And I go onto the support group website all the time and kind of check there, so you can probably message me on Facebook. So I'm happy. I've been in this field for almost 8 years plus, and I've worked with a lot of individuals who've had the sleeve or the gastric bypass, and I love working with this population. I just love it. I don't know what it is about. You guys are real motivated, and I think you care about your health. You cared enough about yourself to get the surgery. So, if I can be of help and help you with whatever you're struggling with afterward, whether not even be about food or something else, I'm definitely available. So you may only need a session or two.
In the beginning, though, you know what? It was more roses and lollipops. But as I have evolved over these 9 years, I have seen things. I've had realizations of things from my past that go, oh, okay, that makes sense. That's what I'm talking about.
Well, it's good. I think the fear is if it motivates you in the right direction to seek help, I'm all for the fear. I think that's great. It makes you vigilant, and that's what emotions motivate us, right? And for some of us, we don't seek help or support until the pain gets bad enough. So maybe nip it before that and care enough about yourself. But
food just to let go.
And I have heard people say that, you know what, there's no way. I spoke with someone, and she said to me, well, I want to have the surgery because I will never, what did she say? She says, I will never have to worry about my weight again, is what she told me. And I went, huh? I said, wait a second, I don't know what surgery you're talking about. She goes, the bypass, I'll never have to worry about gaining weight. And I went, really? I said, let me tell you a story. I said, it's not true. And I can tell you, I know dozens, honestly guys, dozens and dozens of people who have had surgery, and I maybe haven't seen them in a year, and I see a picture and I'm like, oh my gosh. I mean, we're not talking 20 pounds. We're talking a good 50 pounds on these people, you know, that thinking, but I watch what they're doing and I'm thinking, that's the problem. That's the problem. They are really out of control. They're completely out of control. And, you know, the sad thing is I think that we are a society that we celebrate with food, we mourn with food, we have food because we're bored, all kinds of stuff, you know.
I remember after the holidays, you know, we had all these people over and we had like whipped cream, canned whipped cream in house for whatever we had. So I started putting it on my coffee.
Oh.
I was like, oh, and then the holidays were over and I was still buying a can of whipped cream for the coffee, like into January. And then I had to go, wait a minute. Holidays are over. There's nothing else. We're putting this. Why am I buying whipped cream for my coffee? And it was acknowledging, and it was really hard. And yeah, the kids did miss it because they do like doing that. But I had to say, why am I buying whipped cream for my coffee? And I had to like walk away from it. Yeah.
My kids were here, and my son, he opened the refrigerator, he goes, I see you have nothing to eat. I'm like, wait a second.
I have plenty to eat.
There's zucchini, there's cucumbers.
No, real food.
He goes, but you have nothing to eat. I said, this is what we eat. He says, I don't know what happened to you people, but he says, this is not the food that used to be at this house when I lived here. I said, well, those people moved out and other people moved in. So, yep.
But then look at what that food has enabled you and Chuck to do now. Look at the lives you live now because of what you're eating and how you eat.
And they'll get used to it in the morning now because I have 4 kids at home. And in the morning now I'm doing the protein shake, and there's cucumber and there's green apple and there's kale and there's spinach and then there's berries, and they'll drink if they can't see it, if they can't see that in there, and they're used to it now. And I go, don't you feel better? And they're like, okay, yeah, we feel better. But they would never make that for themselves. But if it's there, and they'll look in the refrigerator at night, there's nothing there. There's nothing there anymore. Maybe somebody will find cereal in a back cupboard and go, I found some cereal. But that's about as much as there, because if it's there, we're all going to want it. Yeah.